Welcome back. Dr. Erin Maslokwsi joins us today to discuss new clinical guidelines issued for treating low back pain. Now, we were just talking, this is a pretty common problem that a lot of people face.
Absolutely. I think the study cites 25% of adults have had an episode of low back pain in the last 3 months, but our studies show us that the majority of adults will experience an episode of low back pain at some point in their life.
What causes something like this for low back pain for patients who come in?
I think that is one of the challenges that we have as providers who treat low back pain, is that the causes are numerous.
So we were talking about new clinical guidelines. What are some of those guidelines now that are different than they were perhaps in the past?
Well, these guidelines emphasize something that I think those of us who practice this type of medicine have known for a long time, that the best approaches are those that involve an exercise or mindful-based approach to treatment before medications. So things like seeing a chiropractor is reasonable, even low laser therapy is cited, certain exercises that emphasize trunk strength and relaxation, some good mind-body practices such as Tai Chi and yoga can also be helpful.
What kind of things can people do to maybe prevent it, maybe before you even get to the doctor's office, that can help prevent back pain?
Well, there's a lot of options. It seems to be that changing positions throughout the day, having an active lifestyle are very helpful to folks. We see people who perhaps are in one position, whether it's standing too much, sitting too much, lifting, using poor body mechanics. Those seem to be problematic for folks.
All right. Well, thank you so much for the great information. Appreciate you having us.
Thanks for having me.